Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Today I want to talk to you about one of the most important topics in medicine, and that is medical malpractice. Understand that I'm not defending doctors who've committed outright negligence, and I think they need to suffer the consequences of what they've done. But there is plenty of times that just, quote, shit happens, end quote. So today let's deep dive into what is considered medical malpractice and what isn't, and the implications, the current climate in healthcare, and what the future of medicine looks like if the current state of malpractice continues. So malpractice is a critical issue in the healthcare industry, and one that has profound implications for both patients and medical practitioners alike. It refers to instances where healthcare providers failed to meet the accepted standard of care, and that's key, resulting in harm or injury to a patient. However, the intricacies of medical malpractice lawsuits are often misunderstood, leading to a landscape rife with misconceptions. While many people are quick to point fingers, it's important to unpack the realities surrounding medical malpractice, including the high prevalence of frivolous lawsuits, the misinterpretation of complications as negligence, and the impact of defensive medicine on patient care. One of the core misunderstandings associated with medical malpractice is the difficulty that patients typically have in distinguishing between bad outcomes resulting from chance and those that arise from genuine negligence. Medical malpractice is inherently fraught with uncertainty. Treatments can produce unexpected results due to individual variations in patient responses, up-to-date medical technology, and the unpredictable nature of diseases. For instance, surgeries carry inherent risks that even the most skilled surgeons cannot entirely eliminate. Patients often expect perfect outcomes. However, when those expectations are not met, they may quickly assume negligence or malpractice. This misconception harms not only the healthcare relationship, but also reduces the overall trust and confidence in the medical system. Such misunderstandings often escalate into lawsuits that distract from the actuality of the situation, with patients failing to comprehend the complexities of medical decision-making. Now let's talk about defensive medicine, which is a consequence of malpractice fears. So the fear of litigation has driven many doctors to practice defensive medicine, wherein they conduct additional tests, procedures, or consultations primarily to protect themselves from potential lawsuits, rather than out of clinical necessity. This practice is intended to mitigate legal risk, but inadvertently masks a deeper issue affecting patient care. Defensive medicine significantly raises healthcare costs, strains resources, and often detracts from the quality of care. When healthcare providers feel compelled to overtest or overtreat due to fear of litigation and being sued, they may spend less time focusing on direct patient relationships or the underlying cause of healthcare issues. Furthermore, patients often feel overwhelmed by unnecessary tests or procedures. And what this leads to is confusion and distrust in their care. So in this way, the fear of malpractice lawsuits not only silences doctors and their ability to make informed clinical decisions, but also diminishes the overall patient experience. So now let's get on to the prevalence of frivolous lawsuits, and that's a real problem. The perception that medical malpractice is rampant often overlooks a significant reality. The majority of lawsuits filed in this domain are considered frivolous. They have no merit. According to several studies, only a small fraction of medical malpractice lawsuits result from genuine negligence, which is a deviation from the standard of care. Many suits stem from a misunderstanding of medical complications or adverse outcomes. Patients and families, in their distress and urgency for answers, often misinterpret unfortunate health developments as evidence of a doctor's failure to act responsibly. This sometimes is not the truth, a lot of times. Complications can arise in medical treatment without any negligence whatsoever. They are sometimes inherent to the treatment process. For instance, Reactions to medications or unexpected surgical outcomes can occur for a host of reasons that do not involve a breach of duty by the doctor or surgeon. This aspect often leads to a stigma against healthcare providers who can find themselves embroiled in legal battles simply due to unfortunate circumstances, rather than a lack of due diligence or care, and certainly not because they're incompetent. Often this can derail the careers of outstanding physicians who've not committed negligence or have deviated from the standard of care. Then what this leads to is physician burnout, or sometimes even physician suicide. And I know people who have committed suicide, and it's tragic. Eager lawyers looking for a payday can convince a distraught family or grieving family to file a lawsuit against any doctor who's done nothing wrong. Believe me, there are a dime a dozen. So with that, I hope you learned something today. Thank you so much for listening. For more information or guidance, you can go to my website at www.paladinmds.com, and have a great day.